When we're on the trail or involved in an MSC activity and somebody has a medical problem, our instinct is to provide assistance. We may pull out our first aid kit and begin to administer treatment. But because most of us aren't trained medical professionals, providing first aid often isn't the most valuable or important thing we could do. We should be thinking in terms of first aid management rather than first aid administration. MSC encourages all stewards to have current first aid and CCC or CPR training. But the purpose of this discussion is to help you manage medical situations just as your other training might help you treat them. In fact, we suggest that you not advertise your training, since it might unduly raise expectations about your expertise or ability to help. The following guidelines were developed with the input of medical professionals and emergency responders. But these suggestions do not replace training and personal good judgment. Always follow the instructions of medical professionals and emergency dispatchers and responders. In order to manage a medical situation, you need some equipment and knowledge of some basics. Let's start with equipment. Whenever you're hiking, we suggest carrying the following gear. First, a fully charged cell phone with service that works in most of the preserve, for obvious reasons. Have a way to determine your location if you need to provide it to emergency personnel. This includes carrying a preserve map and a GPS or appropriate cell phone app, and knowing how to use them to determine and describe your location. Have a basic first aid kit, although you rarely should use it. Carry lots of water. Water is the best medicine you can carry for many medical problems, from easing dehydration and heat exhaustion to cleaning cuts and scrapes. Have a clean bandana or some other means to apply pressure. Of course, you'll have a Cactus kit with a comb and pliers or tweezers or forceps for dealing with choya balls, etc. Finally, have an accident form or carry some other means of documentation like a pad and a pen. There are some basic elements of managing almost any medical situation. First, ask for permission to assist from the patient or a relative, or determine that the patient is alone and unresponsive. Remember that an alert adult patient can refuse assistance, ignore your advice, etc. Just document if this occurs. If the patient is unresponsive and not breathing, of course you should call or have someone else call 911 and initiate CCC or CPR immediately. If an injury appears life-threatening or immobilizing, call 911. If time permits, try to find out what happened from the patient or bystanders to help figure out the nature and extent of the injury and how to manage the situation. If necessary, protect yourself with gloves or whatever else is needed. Protect and support the patient's head and spine if there's any evidence of a head or spinal injury. Don't provide any medication. No alcohol sanitizer, no aspirin or ibuprofen or acetaminophen. No nothing. Document everything or have somebody else do so, and confirm your decisions and actions with witnesses if possible. Report or have someone else report all incidents to the MSC Executive Director and to Preserve staff as soon as possible, and file an accident report soon after the incident is over. In any 911 related incident, and on any occasion when you think it appropriate, call the MSC Executive Director immediately. The cell phone number is on your badge. Finally, don't speak to the media during or after an incident. If you've briefed the MSC Executive Director and Preserve staff, they'll do that. You don't have to do everything yourself. In fact, you should ask the patient or others to help as much as possible. But once you start to manage the situation, you're responsible for seeing that appropriate actions are taken regardless of who does them. Try to remember these basics in every medical situation. Now let's discuss 911. We, and sometimes patients, are far too reluctant to contact 911. If in doubt, call them. It doesn't cost anything to do so, and in fact, even evacuation back to the trailhead doesn't cost anything. Charges are incurred only if the patient needs emergency transportation to a hospital. Here are some circumstances when you should call 911. Of course, if the patient isn't breathing, start CCC or CPR while someone contacts 911. If the patient is unconscious or unresponsive, even for just a few seconds and with apparently full recovery afterwards. If the patient was hurt badly enough to lose consciousness, something bad may have happened inside the patient's body, even if they look and act okay. Call 911 if the patient is immobilized with a broken leg or hip, a badly sprained ankle, a dislocation, etc. Call if the patient is in great pain or having chest pain that doesn't subside very quickly. If there's any indication of spinal or head injury, like confusion or numbness, tingling, inability to move extremities, stabilize the head and spine while calling 911. Call 911 if there's heavy bleeding that doesn't stop after a few minutes of direct pressure. And when in doubt, call 911. Here's how to work with 911 operators. First, answer their questions. They'll want to know the nature of the emergency and your location. Be prepared to briefly describe the situation and the patient's symptoms. Be able to give them the address of the nearest trailhead, the trail you're on, the nearest emergency marker, and possibly your GPS coordinates if needed. This is why you always should carry a preserve map. Tell them what you or someone else has done and is doing with the patient. For example, CCC or providing direct wound pressure. Now let's apply these ideas in practice. The most common medical situations we encounter are first, cactus mishaps, next, dehydration and heat-related problems, bleeding from cuts, scrapes, and punctures, musculoskeletal injuries like sprains or fractures, finally, head or spine injuries due to falls. Fortunately, we have not had many really serious medical situations in the preserve so far. Let's apply the ideas we've discussed to a cactus encounter. Suppose a hiker has accidentally backed into a cholla and now has several cholla stegments stuck on his lower leg. What should you do? Would you whip out your Cactus kit and proceed to flick off the cactus? No. Instead, you'd manage the situation. First, you'd remember the basics and ask the patient if you could help. Then you'd caution him not to touch the cactus or try to scrape it off. The real key, though, is that you would have the patient do as much as possible for himself, using either his own gear or yours. If the patient had a comb, you'd ask him to take it out. If not, you'd give him your comb and tell him how to use it to flick off each cactus segment without sending it flying into somebody else. Then you'd have him use either his own pliers or tweezers or yours to remove other visible spines. Finally, you'd assess the ability of the patient to continue. These situations usually are minor, but if the patient can't or doesn't want to continue, then you'd ensure that someone accompanies him back to the trailhead. Now consider dealing with dehydration and heat-related situations. The initial signs of such problems are subtle: unusual tiring, tripping on small trail obstructions, and generally acting in an uncharacteristic way. As heat exhaustion progresses, more obvious symptoms develop, including rapid breathing and an elevated heart rate, dizziness, feeling nauseated, even cramps in large muscles like the legs. The patient may be pale, cool, and clammy. One way to confirm the problem is to ask the patient or a friend how much water they've had in the last few hours and when they last urinated. People who've had far less than the recommended 1/2 to 1 liter of water per hour of exercise, or who haven't urinated for many hours, are likely to be suffering some degree of dehydration or heat exhaustion. After remembering the basics of first aid management, treat the patient by getting them into shade if possible. Encourage them to drink their own water or a highly diluted sports drink. Ask if they have a bandana or provide one. Have them soak it with water and place it on their head or around their neck for evaporative cooling. Have them rest until their symptoms subside. But if their respiration and heart rate stay high, or if the situation gets worse, for example, if they get disoriented, confused, combative, or unresponsive, call 911 immediately. We see other medical situations on the trail, but this basic approach can be applied to any of them. Information about identifying and managing other medical situations is available on the MSC website. Remember that our actions in managing medical situations are covered by Arizona's Good Samaritan law. This law protects us as long as we provide our services gratuitously and in good faith and are not guilty of gross negligence in rendering aid. Gratuitously means with no expectation of payment or reward, and this includes not asking for donations to MSC. Gross negligence means providing care beyond one's level of training, like performing a tracheotomy because you saw it done on television, or almost totally disregarding the welfare of the patient or the consequences of your actions, like chatting with other stewards rather than performing CCC or CPR and calling 911 when a patient is not breathing and unresponsive. Fortunately, none of us is that dumb. Let's summarize these ideas. Unless you're a medical professional, think in terms of managing a medical situation rather than providing care directly. Managing the situation means thinking about what needs to be done and how best to do it. You don't have to, and probably shouldn't, do everything yourself. You should ask the patient or others to do as much as possible. But once you start to manage the situation, you're responsible for seeing that appropriate actions are taken regardless of who does them. Many of us are likely to be involved sooner or later in medical situations on the trail. We hope these guidelines will help you deal with them calmly, confidently, and successfully.